Hello, everyone. Welcome to another edition of Talking Away the Taboo. I'm Dr. Aimee Baron, and today we are bringing on Eli Weinstein, who is an incredible therapist who is going to be talking to us all about relationships and how your relationships can thrive. I said thrive. I know you didn't expect me to say thrive, but how your relationships actually can thrive instead of decline or have conflict while you're dealing with infertility or loss. And so I'm going to bring him on right now, and we're going to talk all about this. Too about this is for a couple of reasons. Number one is that, let me just make sure he's coming on here. Number one is that here he is. Um, hello, hello.
Hey, how are you?
Okay, so I'm just doing a small introduction, and then I'm going to let you pass it over to you. But the reason why I chose Ellie as the person that I wanted to have this specific conversation with was because number one, Ellie has his own story. He and his wife have their own story of infertility, and so he is intimately familiar with the struggles that couples can go through. But two, Ellie is also now a licensed clinical psychologist, social worker. And so he has this other lens where not only is it his personal experience, but it's also part of the work that he does on a daily basis. And so he spends his time, in addition to the other pieces that he works on and works with patients on, but part of the work that he does is specifically talking about the fertility challenges that one can face. So, Ellie, now that I've basically stolen your whole introduction, say hi to everybody and introduce yourself.
Hi, everyone. My name is Eli Weinstein. I'm an LCSW. I live out in beautiful Vegas, and I'm licensed in New York and Nevada, as well as work with other people in between. I'm still learning all the geography. You know, I got to get used to it now. From New York, I didn't know geography, and now it's like I got to know things now about geography. And super excited to be here. Aimee, you know, I'm a huge fan of what you do and all that you do for so many. We're always there to support you, my wife and I, and anything that I can do to help. So you asked, I'm here.
I,
Um,
I'm so grateful. So let's just get into it. And can you share, just tell people, just give them an overview as to what you and your wife have experienced, so they can really understand why this is not only clinical for you, but it's also personal.
yeah, for sure. So my wife and I went through infertility, had to go through multiple rounds. We have two kids through IVF with failed transfers on each one. You know, all the ups and downs, the hopes, the dreams, the sadness, the crying, the laughing through it all, and the connectors that it has to this beautiful community of and involved in so many different things. I'm involved with you, I'm involved with PUA and other organizations to help them through all these kind of struggles, and actually still now going through infertility struggles as we speak. Um, Finding out different information, different things about my wife and I, trying to do things differently, but we have a lot of knowledge based now compared to when we first started this process. Technology and understanding of systems and hormones are different from 6 years ago when we started going through it. And I have to tell you, the reason why we actually started looking into us having infertility was a conversation like this at a shul. It
Wow.
was a panel discussion at Shank in the Upper West, in the Heights where we lived, opening up about infertility and realizing that it happens to so many people, and it wasn't talked about that much. And it's still a struggle to talk about it, but so many more conversations like this whole week that you're doing is happening, didn't happen 6 7 years ago. So that's a little overview. My Our embryos are still actually in New York, so that's a fun thing,
Okay.
and all that nuanced stuff. But we're making it work and seeing what we can do. So that's kind of a little overview of what we've
Okay.
gone through.
Okay, what I always say to people is that I love working with people who have this personal background because they really get it in addition to having their professional lens. But I hate the fact that we're meeting like this. And
Yeah,
even though you and I have met many times beforehand, I hate the fact that our
this is our
relationship
connector.
started because of all this. But okay, today we want to sort of delve more into the relationship piece, the interplay between a husband and a wife or any partners. And whether you're married or not, same-sex couples, heterosexual couples, the reality is that it is known that any kind of fertility struggle creates and places a tremendous strain on a relationship. Can you just in general, I don't know if you have statistics or you have even just like the general ideas of what people go through and why it's so difficult. Can you give us a broad overview on that?
For sure. So I work with couples and individuals basically every day. Um, and let's be frank, sex and that intimate part of relationships is a stressor in all couples, whether they have an easy time getting pregnant or don't. It is just a very sensitive topic, a very vulnerable and open topic between a couple to really be themselves and it feel that things are not working the way they should, expected, or hope to. And I think that a lot of couples don't understand how difficult it is to get pregnant if everything is healthy, and that it's an assumed thing that you have sex, bam, baby. Um, and no, and when you finally start looking and going into the research and studies of the numbers and statistics, even healthy people have struggles. And I don't know what the numbers are now, but when we were kind of going into it, 1 in 5 couples have infertility struggles, and it could be the male, the female, or unknown, or both. Um, and the struggle that happens is guilt and blame, right? So this is on me. It's my problem. I'm the issue. Why would you marry me? Why would you be with me? I feel so bad that you have to go through this because of me. Or the opposite side of, how could you do this to us? I didn't know this before we were married. How come you didn't tell me? Maybe I wouldn't, maybe it's thoughts of maybe I wouldn't be with you if
Yep,
I knew this. And it creates this kind of bubbling. And if you look at the research of just relationships, and I'm going to go a little bit with Gottman right now, Gottman Institute, and their kind of research, one of the biggest struggles in relationship, and they call the 4 horsemen or a decay of a relationship, is contempt. And when I am upset to the point of disgust at you for an issue, which leads then to hate, resentment, and can be a very poisonous thought process to a couple. So it happens to a lot of people, not just with infertility issues, but any issue that can happen, but especially with infertility, the guilt on the people and the shame they feel embarrassed that they're not living up to a standard or an expectation of, I've been married for, let me do the math, why am I not having a kid? Right? And people's commentary, people's pressures, which is a whole nother issue that people need to stop doing. It's a little ridiculous that people care that much about other people's sex life and their
totally.
pregnancy. Get over it. Focus on
Yep,
yourself. Stop looking at other people and if their belly is big or not. Who
totally.
cares? Stop it. It's ridiculous. So, and it really can create an isolation of a couple. And we saw during COVID, isolation is one of the hardest places to have a healthy mental health. So when you are feel alone and nowhere else to turn, and that you're just weird or off or not the quote unquote norm or average of a couple to have a kid, it creates this very sad, dark place to be in, which some people and most people don't know how to be in with someone else. They can do it alone maybe because no one else is relying on them or no one else is with them to talk and be and grow and learn and love. But when you're with someone else, sometimes people don't know how to handle that. And it's a really hard journey to go through. And something that we can talk on further, how to kind of either get out of it or support each other.
Yeah. So I want to actually dig deeper before we even get to like the what to do's because we're going there. Promise everybody, we are going there. But before we do that, I want to dig deeper on the idea. Like, yes, sometimes you do get a diagnosis, and it's both people, like this one is a little bit like the sperm is not so great and the eggs
Yeah.
are not so great, or your uterus is not so great and like maybe he can't perform, like whatever it is, like sometimes it really is both.
Yeah.
But more often than not, it is one person's
Yeah.
fault. And I'm using the word fault specifically here because it's a lot of the things that you've said already, that if it's the response, it's your eggs, my eggs that are not
Hmm.
working. And then what? Like, what does that mean? And are you still going to love me? It's taking it from both sides. Are you still going to love me? Are we going to be able to create the family that we wanted? I don't know how to how to even have this like sit with me. I don't know what to think about it. And then it's also on the other side of exactly what you were saying, like I didn't sign up for this.
Hmm.
And I thought my life was going to be different. It was supposed to be different. So how do you like what are people I guess what are the common things that people are coming in with specifically? And then like now getting to the next part, what do you say to sort of take them out of that and make them think like this is big picture, like in like not in Judaism, like under the wedding canopy, under the chuppah, we don't say in sickness and in health, in riches and in poor. Like we don't do that in Judaism, but that's what everybody does in the movies. And I'm gonna say maybe in other religions they might do that.
They do. Yeah.
So like, just talk to me a little bit about that.
So I worked with a couple years ago that every time of the month when she had her period, it was devastating. And I'm sure you understand that and work with people that that is just this crushing feeling of another month gone by that it's not working. And I've worked with a lot of couples where how to support the husband or the other partner to not get annoyed at that emotion
Yeah.
or that expression. Again, it's been so many months. Get over it. Gosh, we realize this is our situation, right? And that tone and that intensity, right? But what we delve into is their pain, right? That they're getting annoyed at the other person because they're struggling and they're hurting as well. So it's something that to work on and be real with people about the honesty, and the two parts that need to happen for support is safety and security, right? Not It's not physical safety, right? Hopefully no one's being hurt physically in a relationship, but the idea that I feel safe enough in my own skin to say something and secure that you're going to appreciate or respect how I feel. So it is something that needs to happen in a lot of circles, no matter where they are, in sickness or in health, to have those two things to get through it. But I will add, and this is just a sassy point, it's just my brand, I'm a no BS person. You don't know what's going to happen, right? I hope everyone lives long and well and healthy. You don't know. You can have all the non issues of fertility, and then someone can have a cancer diagnosis, or MS, or Parkinson's, dementia, Alzheimer's. You just don't know what could happen in the future. So, what if you knew that you wouldn't be with the person? There's more to a person than a struggle or a falter or an issue, right? I say this about mental health too, right? So someone has anxiety or depression or bipolar or whatever diagnosis that they have or struggling with or symptoms. Is that the package that you can handle? Because there's more to them than just this pointed negativity, quote unquote, but there's a full person behind it. There's still someone you love and the reasons you love them than just this issue that now is the focus point or the focal point, right? So sometimes if all we're focusing on is the negative of a person and we don't see the full picture of how much love they give you, how much you laugh, enjoy each other's company, their family, your family, the experiences, the home that you've already created together. Yes, there was a huge bump in the road and a huge thing that's now in the forefront of your relationship, but there's more to it than this. So a lot of times it's working with people to see more of the person than just what's in front of them, which is this pointed issue. And I do that with many things, not just infertility, but any struggle, whether it's like credit card debt that someone didn't know about, or financial stress, or a family member passes away and they're now not the person. And there's actually a great book by Dr. Tracy, I don't remember her last name, called I Didn't Sign Up for This.
Ah, I love that
And it's a
title.
great, it's actually she talks about her issues, and I think she got divorced, whatever it is. And she's a wonderful, wonderful therapist that works with couples. And she wrote a book. This is not what I signed for, I didn't know, or I forgot. I'll look it up later and text it to you about the exact title. Her name is Dr. Tracy, and her last name is D. I think it's Delgish, or I can't pronounce it well.
Yeah, yeah.
And so you're right. Most of us do not sign up for half of the things. So what? You signed up for the person that you love, and you signed up to be with a person for the good things. No one expects the bad things. I mean, I have Crohn's. My wife signed up for knowing Crohn's and what that experience is, but she didn't know what that meant. I mean, she didn't know that things were going to be canceled and plans were going to have to be moved and health things or whatever it might be. Thank God I'm all healthy now, but like, you just don't know. So no one signs up for anything. We sign up for the good. And that's what we need to focus on, is reminding ourselves what we did sign up for, which was the positives and why we love a person and why we choose daily to be with that person. So that's a lot of the stuff I focus on, is choosing the positives, choosing, because the negatives can be there and will be there. There's always negatives. It could be the annoying things of you didn't put the dishes away, or how I like it, or small things. And there's going to be big things, because you're hopefully going to live a full life with someone, and a lot of stuff's going to happen that you just don't know or are not ready for. But you have to remind yourself what you did sign up for, right? And look at that deeply, about what that person means to you outside of an issue, outside of a struggle.
I love that so much. I think that there's so much value in taking a person as they are in their totality, and knowing, I mean, even just in the like in the course of a week, right? For all of us that are not dealing with any specific struggle, we all have good days and bad
Yep.
days. You get a good email, you get a bad email, you get into a car accident, you might like fall down, you like the milk that you really wanted for your cereal that morning, like, is expired. Like there are always things that happen, right? And so we take the person for all of the good and all of the bad, and whatever life throws at us. That's the beauty of a relationship. I wonder though about like the when people are specifically in this moment, and they're struggling with disappointment over and over again, and beyond the like, yes, there's the guilt and there's the shame of like the problem is mine, but also there's the regular ebbs and flows of what infertility can bring, the constant, the ups and the downs, good news, bad news, appointments, like stress, the hormones, like all the things. And then also thinking about the grief of not getting what you hoped was going to be the outcome in that kind of a situation, but also even with a regular pregnancy that ends in a loss, where there is a tremendous amount of grief. And often there are two people who are just experiencing the same exact scenarios, but they're experiencing it totally differently. That one person may be totally ready to move on and like, why are we still talking about this miscarriage? Like, why are you still sad? And the other person is like, oh my God, I was hoping and dreaming and planning for this baby. And now this baby is not in existence anymore. And I'm just really
Mm-hmm.
struggling. Like, how do you deal with these like emotional, I'll call them sort of emotional mismatches,
Mm.
and need grief mismatches, let's call it.
Yeah, something I say often, but I work with a lot of people on not grief of a person, but grief of a dream or a hope, right? With relationships, and to me, you cannot compare pain. You can't compare pain and grief. Each person is born with certain abilities to handle one thing over another, and someone might think it's so simple to deal with something, right? And I'll make it as stupid as, some people deal with stub toes better than others, right? Some people have to sit down and breathe through it, and other people just keep going with their day. It's the same stubbing your toe. I mean, every toe is probably the same, with the same nerve endings and all that kind of stuff. I'm not a doctor,
I,
but
I was going to say I might actually like push back on that, but that's not the point of this discussion. So keep going.
right?
For
So
those of you out there who don't know, I am a physician by training. I'm a pediatrician, but we're not going there today. Keep going, Ellie.
and so like you can't be like, oh, you stub your toe, get over it. For some person, it feels very real, more or worse than someone else might assume or feel on their own. So the first thing is like grief needs to be respected. We cannot push someone faster than they are saying they are ready, and we cannot push our way of healing on someone else. When that happens, we are assuming we know what's good for someone when we don't, and we know how someone needs to heal when we don't know how they need to heal. That's how we communicate and talk. And we ask, how are you doing? What do you need? Where are you at? How are you feeling? Another thing I'll add on to that point is when grief happens, and especially the scenario you're giving, where there's loss, especially with the pregnancy and then a loss of a pregnancy, or even just the hope and the buildup of going through a fertility treatment and it failing. Um, the one thing I will say is you're both struggling. Don't go at each other. You're both hurting. Why make each other hurt more? You're teammates. When a team loses, everyone is annoyed, everyone is hurt, everyone's in pain. You don't go at each other and start pointing fingers and blaming. You need to be together with that joint mentality that we both lost. We both have pain. We both have hurt. And something else is that what I would say is it's a very, very scary thing to try again. It's very worrisome because the what if happens again, right? That starts overwhelming our brains. So the biggest thing is you're never going to be 100% ready. But to me, I like to give numbers and ratios like, are you 60%? Are you above the 50% marker where you're willing to try? You're confident enough to give it a shot, but you're not fully bought in because it is scary. That's okay. It doesn't mean you shouldn't try just because you're afraid or scared. We should all be a little nervous and worried that it's going to work out because you never know what's going to happen. So we can't just stop living. We can't just stop moving. We can't stop going just because we've had loss. We need to keep going forward, but we have to respect where someone's at. And if your partner's at a 40% and you're at an 80, you can't expect them to jump to an 80, but maybe you decide on a number that works for you guys. When you're at 55, 60%, we're going to start talking again about trying again. Okay. Because you're at an 80, you're ready, you're gone, you're there. Someone else might not be. We can't force someone to match us, and we also don't want someone to push themselves to jump higher when they're really not ready and then get resentful or annoyed if it doesn't work out, to then go, I told you I wasn't ready for this and you pushed me past, how could you? So we have to wait, and it's very hard, but you love this person, you care about this person, you don't want to make them feel uncomfortable. So that's the perspective. I love you and I want to do this together, but we need to be together on it. It can't be one-sided. It can't be one person. So it is very difficult and very hard.
That's I mean that's phenomenal advice. And it makes perfect sense. I mean, I'll just tell you a story about my own life that when after one of my miscarriages, I remember I was like in bed. I really was. It was very, very hard for me. And for me, grief meant I was in bed most of the
Yeah.
day and just like really couldn't get myself out. And at one point, my husband said to me, he's like, you know, I've read that there's a lot of research out there that says that people who are grieving need to get up and out and get into social situations because that makes them feel better.
Mm-hmm.
And I basically I I I used a few choice words and I basically said, I will get up out of this bed when I am ready. You cannot force me to do something that I'm not ready for.
Yeah.
But it was a real moment in time in our relationship where like we really had to like he thought he was like he wanted to share the research, like he thought
Yeah.
he was doing the right thing by telling me because he knows I'm a science person and that I appreciate research. And I was like, actually, research right now is not the thing that I'm interested in at all. I'm only interested in staying in this bed because I'm a person and like basically like science is science, but like literally leave me alone. Right. And so I so much appreciate that, like really hearing where people are and respecting what they need and communicating about it.
Yeah. And I will say that people often ask, like, yeah, it is a test. It is hard. It's very difficult to go through an experience, and it will challenge your relationship because any hard thing creates emotions and creates worries and anxieties and sadness and fears. And we're usually not used to seeing that so often in our couples, especially when you're dating and it's all love and happiness and excitement. And yeah, there are some bumps in the road that come up, but it's not real life. It's, where to go, what are we doing for our wedding, and what stupid things that pop up because of that. When we deal with real issues, it's going to show a lot about who we are and what we can handle as a couple. And the focus being on the we. And it cannot be one person is the only one invested in the journey. You both have to be. Yes, we know when it comes to, let's say, parenting or things like that, women are going to be a little more into the research and a little dived into being more proactive than men will be, more often than not. But it doesn't mean that there can't be conversations and it can't be talking through, but it's going to challenge. And the research shows that there's this concept called the bubble, right? And the bubble really is the safety protection. Think of Star Wars, of any, like, you know, awesome, what's it called,
Yep.
force field that protects a ship, right? So the bubble is that force field. So we shouldn't prepare for the end of the world or all the things that might happen in a couple or relationship, because it might not. But when things start bubbling or start working up to the surface, the emotions, the feelings, all this big stuff, work on where you guys are at for each other together. Because the external noise is going to happen, whether it's other people asking questions, other people being annoying, family members being ridiculous, holidays, vacations, um, whatever, synagogue, things that you get involved with religiously, whoever you're going to be around, work, you just don't know. So you at least have that force field to keep you safe. And that is the team mentality of each other. But I have the safety and security to come to you and tell you today was really rough. I remember when my wife and I we were in between 1 and 2. And I think we just had a failed transfer. It was a lot of emotions. We were so excited and so ready for a second kid. Um, and it's very precious when I'm not saying that it's more precious or not, depending on the fertility struggle, but we had such a precious love for Ricky, our first child, and with the experience and like the I can't say, I forgot the word I'm thinking of, but it's so like I can't think of the word where something can break easily. Um,
Fragile.
Fragile. The experience is so fragile that, like, you want to make sure you have another kid because it's such a fragile experience where it's like, I don't know if I'm going to have another one. So, like, wanting it is like a very scary, fragile thing. I remember one of our friends got pregnant in between Ricky and Max. I remember being in the car with my wife, and my wife was crying and screaming. And I did not understand why she was so upset because we still had Ricky. I was like, we have a child. We're so lucky and blessed. We at least have one, and we love her, and she's amazing. Why do you care? Now, I didn't say that because that would be really mean. Um,
And because
and
you're
people,
also a trained therapist.
yeah, I make mistakes in my relationship plenty
We
times,
all do.
but we
We
all
all
do. But
do.
like in my
Yes.
head, I'm like, what is wrong with you? But see, that's the problem. I was thinking, what's wrong with you? And she was feeling, I feel safe enough to tell you how the rawest feeling that I have. I had to remind myself of the bubble, of the teammates, the togetherness. I need to put that aside for a second. I can always ask why she's so upset when we have a kid another time. But right now, the bubble needs to be put up. Right now, the force field needs to be put up. Right now, needs to be that comfort zone or that security blanket. Right now, that's what she's begging for because how vulnerable and how real she's being. So it doesn't mean, my point is that you don't always have to have the force field up. It doesn't have to be like you're like this protective zone of like, no one can come between us. You can let people in, right? Support groups, tribes, friends. You can talk to other people. It doesn't have to be just me or nobody. Please don't do that. That can create a very unhealthy codependency. Don't just rely on your partner because sometimes they can't fill every need. It's okay to go outside. But if you do go to your partner, put the force field up. Have that safety and security because that's what they're there for. If that makes sense.
Love it. Yes. 1,000%. 1,000%. Okay. So as we're wrapping up here, I'd love to just hear from you some just very quick ideas about like when there's miscommunication, when there's mismatch, when like things are just not going well and you really just like you love each other and you want to get out of that cycle, but sometimes it's just hard to like even be the person to take the first step or know what the first step to do
Hmm.
should be because emotions are so heightened and you're just like it's almost too much. So I'm
Yeah,
wondering if you could just share, some quick ideas about what to just get people out of that cycle so they can start talking and communicating instead of just
yeah.
constantly battling and like you don't get it and no you don't get it and you don't understand me and all that stuff.
So I have three things. One is the last one is talking to someone, right? When you get out of it, right? To go talk to a professional, talk to an organization that has support, find support groups, find friends that you feel comfortable talking to that tribe, the mentality of that trust and respect to be your true self. That's the last step. Um, Two things I suggest with couples. One is like a little wonky, so like bear with me on it. The first one is a joint journal. And what I mean by that is it is something that you pass between each other. Because sometimes we are afraid to say what we truly feel based on reactions, heightened emotions, bad timing. Maybe someone has a weird schedule and you don't have the time to fully flush out everything you're talking about. So a joint journal is something really powerful where you can write your feelings and you leave it on someone's nightstand, right? I would buy a journal that's a very bright color so they see it, not like a black or brown or navy, like a pink or a purple or a yellow, and you put it next to them, and that's a signal like I wrote you something. I really want you to read how I'm feeling, because sometimes we don't have the words, and sometimes we need to just process it through writing. And don't do a text, and don't do an email. Write it down for two reasons. One, that helps you release that information. Texting still stays kind of in your head, according to some research. So writing it down is very tactile and it kind of gets it out of your head. And two, it's very personal. It's like a love letter. It's very nice and sweet. And it could be real emotions, and that's a safe place to write. It could be you're cursing, you're screaming, you're yelling. You can write in caps if you want. I don't know. Do whatever you want. But that it doesn't have to be clear, it doesn't have to be perfect sentences, but it has to be something. That's the first thing is have that
Can I
journal.
can I ask one quick question about that?
Yeah.
Is there any research on voice notes? Like
Yeah.
what I'm
Voice notes are nice because then you can hear tone and
yeah,
everything. The only thing I would just say is a journal is something that's very private that you can read on your own time and do on your own time. A lot of people are bombarded with so much during the day on their phones itself that they lose track of a text or an email or a voice note. So if you're going to do it, just make sure the person actually listens to it and they have the privacy to listen to it versus like listening to it like right here in public.
yeah.
Please don't do that with any voice note. You just never know what anyone's going to say. But voice notes are wonderful. If that is a better way of saying it, I'm a better speaker than a writer, and my handwriting is atrocious. So it is a beautiful thing, and it can get it out because it is somewhere you're like talking it through. Research does show writing does a lot more
Yeah.
for the brain, for the anxiety. Um, the second thing, and the second thing is time. So what I mean is time away. Now, I'm not saying time away with each other. If that's what you need, go for it. I'm also saying time away from the conversation. What you're talking about is the loop, right? The anxiety loop or the emotional loop that we get pulled back into the same conversation, same emotion, same style. If you look at research by like Dr. Judd Brewer and all these other anxiety specialists, they talk about this kind of loop that gets triggered by words and similarities that pulls us back into the same behavior. Time away from the conversation. You don't have to talk about it every waking moment of every time you have. It's okay to not talk about it. It's okay to not have to be on and talk about it. We feel pressure to be like, this is super important. We have to talk about it now. No, you don't. No one's going anywhere. Talk about it tomorrow. Talk about it the next day. Maybe make a set time a week that you talk about it so that you're ready for it and prepared in your mind versus being bombarded or surprised of, hey, you want to talk about it? Loop. Right, and then freak
Totally.
out emotions. So it could
Totally.
be, Shabbos afternoon when it's quiet in your apartment. Maybe you talk about things where there's no cell phones, no distractions, no things like that. It means every Tuesday night you talk about it. It means you make get to go to Staples and get the big post-it notes and you write things and then you open a closet and it's there and you can pull it out versus it being something so cognitively looped in your brain. So take the time, respect each other to take the time. Don't force someone to talk when they're not ready. And the last thing is go get help. I love when couples work with me before things are bad because it means that they don't want it to get to that point versus we're in crisis and getting divorced. Help me. I would say about 7 out of 10 times it doesn't help because they're already locked into certain belief systems. I wouldn't say seven. I would say maybe 5 to 6. They're already locked into those struggles and those loops and those patterns. Were very hard to break. Talk to someone. Reach out to people. If you're struggling, it's okay. You should be struggling. It's hard. So go talk to someone. But make sure you respect each other through that process because it is difficult for both of you in your own ways. And hopefully you can get through it together. And I know for my wife and I, and I'm not saying this is for every person, it taught us a lot about each other. We had massive blowout fights during it. And it taught us how we fight and how we argue and how we resolve. And also taught us how much we need each other and how much we respect each other to be there when we need it and know that we can. Now, I don't wish that upon anyone to find out that way, but remember, you're teammates and you have each other's back. There's a reason you're together, a reason why you want to be together. Don't forget that, and go back to that when you're overwhelmed. Go back to that when you're sad. Go back to that when you're upset, and hopefully, it solidifies you to realize that you're with a person who has your back and they have yours, and hopefully, it can be okay.
I love all of that. Thank you so much. I mean, what you just said about like trying to attack it, so to speak, and trying to address it before it becomes a problem, knowing that fertility challenges can be difficult and can create all of this havoc. Like it's just what Rachel Tuckman actually said the other day. She said, don't wait until like it's a fire drill.
Yep.
Try to address this beforehand. And
Statistically shows couples come 5 years past issues needed to be. That's the statistics. I would say people it's worse of the intensity that I've seen where it's like the world is ending. Help me. It's like, what do you want me to do? But sometimes people feel that finally when it's
right,
at that end, now they're willing to
right,
try. It's okay
right.
to talk to someone. It's just an objective referee sometimes.
Absolutely.
That's all it is.
Absolutely. That's exactly what Rachel talked about, what we've been talking about all week. We actually we just put up a post about that as well, just about the idea that therapy is not something that's shameful. It's not something you need to be embarrassed of. It's help. It's support. We don't know how to do this alone. We weren't
We
trained.
can't.
Yeah.
We can't. Period.
Yeah. Yeah. So, Eli Weinstein, thank you so, so much for your expertise, for your kindness, for sharing your story. People want to find you, they find you here or also on your podcast because you have a podcast called The Dude
That's my
Therapist,
podcast.
correct?
Yep, it's a party.
It's a party. It's a party. Thank you so much. I am so grateful. And to all of you out there, keep talking to each other. Remember, it's not all of the like heightened emotions. Just keep talking to each other and reach out for support. Thank you. Thank
Thanks
you.
for
Thank
having
you.
me.
Bye, everybody.